So good evening everyone. Today and the next few sessions we will have a rather long presentation on the radiological anatomy of the brain, since we all know that the brain is a very complex anatomical structure with a lot of parts and details and things that we need to know. We have to have a good idea about the radiological anatomy of the brain in order to give a good description when we have any case of a brain MRI. So first of all, we will talk about these structures here: the cerebral hemispheres, the white matter, the thalamus, hypothalamus and pineal gland, the pituitary gland, the brain stem, cerebellum, ventricles, cisterns, and the arterial territorial distribution. I'm sure all of you have a very good idea about all of these structures and parts, but keeping up and refreshing our knowledge is very important to stay fresh. So, first of all, let's start with the cerebral hemispheres. There are two cerebral hemispheres, as we all know, and they lie above the tentorium cerebelli. So, the posterior cranial fossa does not contain any cerebral hemispheres. It contains the cerebellum and the brainstem. These two cerebral hemispheres are connected by corpus callosum, and they are separated by a median longitudinal fissure. It has a cortex, white matter, thalamus, hypothalamus, pineal gland, pituitary gland, basal ganglia, and the limbic lobe. So, first of all, this is a diagrammatic representation of the cerebral hemisphere, showing there are four lobes together. As we all know, they are the frontal lobe, the parietal lobe, the occipital lobe, and the temporal lobe. And at the base of it, we have the cerebellum and the brainstem, which is composed of the medulla oblongata, the pons, and above the pons is the midbrain. These lobes are not separated by real anatomical boundaries. They are separated by arbitrary fissures, by arbitrary sulci. Just the scientists agreed that this sulcus will separate this from this. There is no real anatomical boundary between them. So, just to have a quick idea, the frontal lobe is separated from the parietal lobe by the central sulcus of Rolando, and the parietal lobe is separated from the occipital lobe by the parieto-occipital sulcus, and the temporal lobe is separated from the rest by the Sylvian fissure. So, let's start with the frontal lobe. It extends from the frontal pole of the central sulcus of Rolando to the central sulcus of Rolando, separating it from the parietal lobe, as we said before. So it starts with the frontal pole and it ends at the central sulcus of Rolando. It is superior to the lateral sulcus, or the Sylvian fissure. It's the same thing, the Sylvian sulcus or Sylvian fissure, which is separating it from the temporal lobe. And on the medial surface of the cerebral hemisphere, it is separated from the cingulate gyrus by what's called the cingulate sulcus. We will see some anatomical images for that. Regarding the parietal lobe, posteriorly it is limited by the parieto-occipital fissure, as we said a minute ago, and it is also by a line carried across the hemisphere from the end of this fissure toward the pre-occipital notch to separate it from the temporal lobe. Okay, posteriorly. Inferiorly separated from the temporal pole by the posterior ramus of the lateral sulcus or the Sylvian fissure, and by a line carried backward from it to meet the line passing downward to the perioccipital notch. Yani, what I mean is that this parietal lobe is separated from the occipital lobe posteriorly. This is by the parieto-occipital fissure or sulcus here, and inferiorly by the lateral sulcus, and it's separated from the temporal lobe by a line drawn along this the parieto-occipital sulcus inferiorly, so to separate them from each other. Okay, the medial surface of the parietal lobe, it's bounded behind by the medial part of the parieto-occipital sulcus and in front by the posterior end of the cingulate sulcus. Okay. Regarding the temporal lobe, it presents superior, lateral, and inferior surfaces. It has three surfaces, the temporal lobe, and the lateral surface is divided into superior, middle, and inferior gyri by superior and middle temporal sulci. Contains the auditory cortex and the temporal association cortex. Okay, let's go again to this diagram. You can see this is the temporal lobe divided into superior, middle, and inferior gyri by the two sulci here separating them from each other. Okay. Now, let's talk about the occipital lobe. It is a small lobe. It's pyramidal in shape. It presents three surfaces also, the lateral, the medial, and the tentorial surfaces. It has the visual cortex and the occipital association area. So our vision is mainly in the occipital lobe. Okay. Now, regarding the insula, we talked about that in the previous sessions, where it's located and how it's covered. Again, it lies deeply within the lateral fissure or the sylvian fissure, and it is overlapped and hidden by gyri which bounds the fissure. These gyri are termed the opericula of the insula. And we said we have three opericula, and we'll see images of them in the coming slides. The limbic lobe, that's another lobe that is not visible from the superficial aspect. We need to cut the brain, okay, in the midline to see the limbic lobe. It included the cingulate and the hippocampal gyri, which together arch around the corpus callosum and the hippocampal fissure. So the cingulate gyrus and the hippocampal gyrus and the corpus callosum arching around the corpus callosum and the hippocampal fissure, these form the limbic lobe. So let's start with some anatomy in MRI images. We can see that this is the right cerebral hemisphere, this is the left cerebral hemisphere. Okay, you can see the midline fissure or groove between the two hemispheres. Okay, and each hemisphere contains a gray matter and a white matter. Okay, and the gray matter is on the surface, while deep to it is the white matter. As we said previously, every elevation is called gyrus and every depression is called sulcus. So these are basic facts that all of us we need to know about. This is the first thing. The second thing, you have these sulci, each of them have a name. So first of all, we have, this is the frontal lobe. As we said, it extends from the frontal pole into the central sulcus. So this is the central sulcus, and you can see that the frontal pole is big because it contains all of our personality. It's mainly the main thinking part of our brain is the frontal pole, and that's why it's big in humans, while it's much smaller in other animals. Okay. Anterior to the central sulcus, we have this gyrus, which is called the precentral gyrus, and it is important for the sensory information, while the posterior to it is the postcentral gyrus. Here you can see the postcentral gyrus, and it is mainly for motor movement. Okay, so posterior to the central sulcus we have the parietal lobe. Okay, this is the parietal lobe. Here, the parieto-occipital sulcus, you can see it on the posterior aspects separating the parietal lobe from the small posteriorly located occipital lobe, this one and this one, okay? And within the attachment of the dura to the this is the falx cerebri here, the site of attachment of the falx cerebri to the rest of the dura, there is a triangular space which is a sinus called the superior sagittal sinus that transmits the venous blood into the draining outside the cranial cavity, okay? Now let's go a little bit up and see what's going near the top of the cerebrum. First we have, this is the frontal lobe, and as we said before, the central sulcus here. And how do we know that this is the central sulcus and not this one? The central sulcus is the only one that reaches the midline. So the only sulcus that extends over the cerebral hemisphere and reaches the midline is the central sulcus, and everything anterior to it is the frontal lobe, posterior to it is the parietal lobe, okay? And posterior to it is the postcentral gyrus, anterior to it is the precentral gyrus, and then you'll have three gyri on the frontal, on the surface of the frontal lobe. So you have the central sulcus, the precentral gyrus, and the postcentral gyrus. And anterior to the precentral gyrus, you have three gyri. These are the superior, middle, and inferior frontal gyri. Okay. Now, let's go a little bit more down near the, let's say, the inferior part of the cerebral hemispheres. Here you can see these are the basal ganglia that we talked about before, the caudate nucleus, the lentiform nucleus, the internal capsule, and the caudate and the lentiform nucleus together, they form what's called the corpus striatum. At the midline, just above the corpus callosum, you have the anterior cerebral artery, just above or superficial to the corpus callosum. At the midline between the two thalami is the third ventricle, which is a slit-like containing CSF, okay? And this structure here, this is a cistern, and you can see here the occipital horn of the lateral ventricle posteriorly, and on the medial aspect of the cerebral hemisphere you can see the lingual gyrus, and as we said, at the site of attachment of the falx cerebri to the dura, there is a space that contains venous blood, which is the superior sagittal sinus. Here we have, this is the pons, okay, and at the posterior aspect of it there is the superior colliculus. This elevation here is the superior colliculus, and just inferior to it is the inferior colliculus. So there are four colliculi. We can see here the superior colliculus, okay. Now this is a gross anatomy specimen of the cerebral hemisphere, and you can see that if this is the sylvian fissure, it was somewhere here, and when you cut the tissues around the sylvian fissure, there is another gray matter buried deep inside it, okay. You remove the gray matter of the cortex and the white matter, and there is another gray matter or other gyri and sulci deep to it. So you remove the first layer and then a second layer appear, okay, and this is the insula. We said it is buried or hidden inside the brain, okay, and these gyri also have name, which are the short gyri of the insula and the long gyrus of the insula. You can see this is the long gyrus of the insula, and these are the short gyri of the insula, and at number 4 these are the circular sulcus of the insula. So we have some gyri and sulci also within the insula. And we can, the part that we removed are the opericula. This part that we cut to expose the insula, they are called the opericula. And we have the frontal operculum, the frontoparietal or parietal operculum, and the temporal operculum. So there are 3 opericula. So till now everything is okay. Do we understand everything, or we have anything to ask or re-explain? Okay. So let's go to the lateral aspect of the cerebral hemisphere. The lateral aspect of the cerebral hemisphere, you can see here, these are the frontal lobes, okay, and here we already under the surface of the brain, it's a sagittal image, so the opericula are removed or are not seen, not visualized here, and you can see there is gray matter here. This gray matter is the insula, okay, the gray matter is the insula, and this is the temporal lobe, okay, and the cerebellum separated from the rest of the cerebrum by the tentorium cerebelli, okay. Now we are exactly at the midline. Someone is asking for the operculum. On MRI you need to see the operculum on an axial images, they are the best. You can see here, this is the insula and it is covered by this operculum, and if you go a little bit higher you see the other operculum and the other. So you can see this is operculum and this is another operculum covering the insula, okay. So they are covers. When you remove this you remove it, and you remove this one and the other one that is not shown in this image, you can see the underlying insula. It's covering the insula, okay. And I think I said the colliculus was related to the bones. No, it's related to the midbrain. I'm sorry for that, it's just a little mistake. So these are the collicula that are related to the midbrain. This is the upper part and this is the midbrain, okay. So this is a sagittal image at the midline of the brain, at the level of the midline, which is the site of the falx cerebri, okay. Of course the falx is difficult to be seen here because this is parallel to the falx, so we will not be able to see it. Let's start from inferiorly and going up. First we have this spinal cord, and this from here to here is the foramen magnum. So the spinal cord becomes the medulla oblongata at the level of the foramen magnum, is the site of transition from spinal cord to medulla oblongata, and above that we have the bones and then the midbrain. These 3 structures together are called the brain stem, okay. And just posterior to the pons, this is the pons, posterior to it you have this space which contains CSF, and it's the 4th ventricle, and covering the 4th ventricle we can see the cerebellum. This is the cerebellum, which is separated from the rest of the brain by the tentorium cerebelli, okay. Now this is the occipital lobe, which is separated from the parietal lobe by this sulcus, which is the parieto-occipital sulcus, the parieto-occipital sulcus. Also we have here what's called the lingual gyrus, okay, and by continuing the line inferiorly it will be separated from the temporal lobe, okay. Now this whitish structure at exactly the midline, this is the corpus callosum, and the corpus callosum is composed of the following parts. First of all we have the rostrum, the genu, the body, and the splenium. Rostrum, genu, body, and splenium. And the anterior cerebral artery is passing just superior or superficial to it. Yeah, there is another sulcus at the occipital lobes within the calcareous sulcus that is separating it from the rest of the brain on the medial aspect, okay? On the medial aspect of the cerebrum, sorry. Anyway, so back to our where we were talking about the corpus callosum, and the anterior cerebral artery is passing on the superficial aspect of the corpus callosum, and this is the cingulate gyrus. This is the cingulate gyrus, which is part of which lobe? We talked about it in like a minute ago. This is the cingulate gyrus, which is part of what lobe? The limbic lobe, exactly. So this, the cingulate gyrus, is a part of the limbic lobe, okay? And then we have the red line here is the cingulate sulcus, okay? Now, this is the site of the anatomical position of the third ventricle, which is a slit-like space, the third ventricle, which is located between the two thalami. Sometimes you see an object or a little bit of brain tissue here. That's called the massa intermedia. That connects both thalami. Sometimes it's present, sometimes it's not. It has no known clinical significance. And then the CSF from the third ventricle will flow into the fourth ventricle via this line, this very thin line, which is the cerebral aqueduct of Sylvius. This is the cerebral aqueduct of Sylvius, and you can see posterior to it are the colliculi. Posterior to it, anterior to it is the brainstem. This is the tectum containing the superior colliculus, inferior colliculus, and here we have the tegmentum of the midbrain, which is part of the brainstem. Now, from the fourth ventricle, the CSF will pass into the subarachnoid space via three foramina. That is the foramina of Magendie or foramina of Luschka. It's not easily seen here. You can see this one, just the foramen of exactly the foramen of Magendie and Luschka. So, at the level of the just inferior to the cerebral hemisphere, we can see this soft tissue and signal intensity, which is the pituitary gland that lies in the sella torsica. This is the sella torsica holding the pituitary gland, and the pituitary gland is attached to the rest of the brain by the pituitary infundibulum, or the stalk of the pituitary gland. So, do we have anything that we did not? This is the only sulcus that is reaching the midline. So this is the central sulcus, and this is the precentral lobule on the medial aspect of the brain, of the cerebral hemisphere, and the cingulate gyrus, we talked about it, and this is of course the atrium of the lateral ventricle. Now, let's talk a little bit about the white matter. The white matter is like a very big bundle of wires. Okay, big bundles of wires. All of them, they are going into the cortex and going deep and ascending and descending and going laterally, superiorly, in all directions. So it's a big bundle of wires that connects the brain to the rest of the body. So within the cerebral hemispheres, there are three types of fibers. These are the commisural fibers, the association fibers, and the projection fibers. What's the difference between these three? First, the commisural fibers, they connect the areas of the same areas on the two cerebral hemispheres, like the precentral with the precentral, the postcentral with the postcentral, corresponding areas on the two cerebral hemispheres, the commisural fibers. While the association fibers, they connect different parts of the cortex within the same hemisphere. So it might connect the frontal to the occipital, for example, the parietal with the temporal lobes. So they connect different parts of the cortex of the same hemisphere. They do not cross the midline. while the projection fibers, they join the cortex to the lower centers. They join the cerebral hemispheres to the lower parts, lower centers. Okay, so the commissural fibers, the biggest one and the most obviously seen one, and the most the one that contains the biggest number of fibers or wires, let's say, is the corpus callosum, which is about 10 centimeter in length, and it thickens as it progresses backwards. So it starts very thin at the rostrum, and as we go posteriorly, when we reach the splenium, it will be the thickest. And it divides into the 4 parts, as we said: the rostrum, the genu, the body, and the splenium. And don't forget that the anterior cerebral arteries run on its superior surface. Now, this is a gross anatomical specimen showing the corpus callosum, which is a commissural fiber. It's fibers that connects the same areas on the 2 cerebral hemispheres, composed of the rostrum, the genu, the body, and the splenium. Okay, and you can see here, this is the cingulate gyrus, and you can see the cingulate sulcus. So this is the cingulate gyrus is part of the limbic lobe, as we said previously, and this is the temporal lobe here, and you can see the hippocampus. This is number 8, the hippocampus. Okay, and I don't want to talk about the anterior commissure now until we explains it a little bit. Okay, now other commissural fibers that are located, that have the same function of the corpus callosum, includes the forceps minor and the forceps major, and the tapetum. Sorry, the forceps minor, they are we were talking about the forceps minor, which said these are the fibers arching forward from the genu of the frontal cortex bilaterally. The frontal cortex, they connected bilaterally by small fibers. They arch anteriorly. They are directed in anterior position. While the forceps major, from the splenium, they go to the occipital cortex bilaterally. So it is directed posteriorly. While the tapetum are fibers that extends laterally from the body. Okay, from the body of corpus callosum. All form a part of the roof and the lateral wall of the lateral ventricle. So all of these, the forceps major, the forceps minor, and the tapetum, are parts of the roof and the lateral wall of the lateral ventricle. So let's go where we, I think here. Here at this cut, you can see these tiny fibers here. These are the anterior commissural fibers. These tiny parts are the anterior commissural fibers. Okay, so let's go back and now the commissural fibers, which are at least 4 commissural fibers. These are the anterior commissure, the habenular commissure, the posterior commissure, and the hippocampal commissures. The anterior commissure, they are a bundle of fibers within what's called lamina terminalis, which is at the anterior wall of the third ventricle. The anterior wall of the third ventricle, the ventricle that is the slit-like, okay, contains the anterior commissure. This is different from the forceps major, and this is the anterior commissure. It's a commissural fibers. Okay, this is a part of the olfactory system connecting the olfactory bulb and the cortex of the anterior perforated substance. So it is a part of the olfactory system. It has it is related to the function of smelling. Okay, While the habenular commissure, which is the second type of the commissural fibers, they are above and anterior to the pineal body, so it's posterior in location. The pineal body located just below the splenium of the corpus callosum, and above it and anterior to it is the habenular commissure, which unites the habenular striae, which they are fibers also from the olfactory centers from both sides. The posterior commissure is anterior and inferior to the pineal body, okay, connects the superior colliculi that we saw before. So the habenular commissure is anterior and superior to the pineal body or pineal gland, while the posterior commissure is anterior and inferior. So both of them are anterior to the pineal body. The habenular is above and the posterior commissure is below. The hippocampal commissure, this is the commissure of the fornix. We will see the fornix in a while. So let's see here. First we have, this is the pineal body, okay, and we have two commissures. One is above and anterior, and one is below and anterior. So the above and anterior commissure is the which commissure? The superior and anterior.
Habenular fissure.
It is the habenular commissure. Here we have the habenular commissure, which is very tiny bundle, not easily seen, while posterior and inferior is the posterior commissure, okay. And just here at the anterior wall of the third ventricle, this is the third ventricle, the anterior wall of it, or the anterior boundary, is called the lamina terminalis, and here you see the anterior commissure here, okay, the anterior commissure. This is the lamina terminalis, which is the anterior wall or the anterior end of the third ventricle, okay. And if you look carefully, you can see this thing within the, or just inferior to the corpus callosum, and this is the fornix that we talked about also as part of the commissural fibers, okay. Now yes, it is continuous with the fornix, exactly. Someone is asking, is it continuous with the fornix? Yes. Now let's come to the third type of fibers. These are the projection fibers. We said it connects the brain with the rest or with the lower centers, and these are either afferent or efferent. Afferent, they either going up or going down, let's say that afferent or efferent, and it's called the internal capsule. So the internal capsule contains the nerve fibers that connects the cerebral hemispheres to the rest of the nervous system, to the spinal cord, to the midbrain, brainstem, whatever you like, okay. All the fibers, they go up and down through the internal capsule via the projection fibers, and they lie, as we said before and we showed in several examples, lateral to the thalamus and the corona radiata as they fan out between the internal capsule and the cerebral cortex. The internal capsule has both sensory fibers and motor fibers. It has anterior limb, posterior limb, and a genu. The anterior limb is located between the caudate nucleus and the lentiform nucleus, while the posterior limb is between the lentiform nucleus and the thalamus. Okay, we can see here, this is a magnified view of the cerebral hemispheres, the axial images, and we can easily appreciate this is the thalamus here, and this is the lentiform nucleus, and this is here the caudate nucleus, or the head of the caudate nucleus, and you can obviously see that the head of the caudate nucleus is connected to the lentiform nucleus by this tiny striations and forming what's called corpus striatum. And you can see this whitish thing here. This is the internal capsule composed of an anterior limb, genu, and posterior limb, and these are fibers going from the cerebral cortex to the rest of the central nervous system, and it has both anterior and posterior commissure. So The anterior limb is composed of frontopontine fibers that goes from the frontal lobe to the pons, while the genu of the anterior 2/3 of the posterior limb, they contain motor fibers. In the genu and the anterior 2/3 of the posterior limb, which goes from like anteriorly to posteriorly, the head, then the hand, then the arm, then the trunk and the legs and the perineum and so on. Okay, so if you have a, for example, lacunar infarct here, you can expect the frontopontine fibers to be involved, while if the patient have a lacunar infarct at the genu or this part of the posterior capsule, you can expect some motor deficit. Okay, the distal part of the limb, of the posterior limb, contains the parieto-pontine and the occipito-pontine fibers with sensory fibers. So the fibers that connects the parietal lobe, okay, and the occipital lobe with the pons are contained at the most distal part of the posterior limb. Then there will come some visual fibers, and auditory fibers are the most posterior fibers. Okay, now this is an axial image of the brain through the internal capsule, showing the corpus callosum here. This is the area of the genu of the corpus callosum, and you can see the forceps minor. It should be, if you go a little bit further inferiorly, you can see it even better, but some fibers are visible here. And you can see the head of the caudate nucleus, the lentiform nucleus composed of the globus pallidus and the putamen. Together these form the corpus striatum, and this is the internal capsule. Here is the frontopontine fibers, then motor fibers at the genu and the anterior 2/3 of the posterior limb, and then comes the rest, the parieto-pontine and the occipito-pontine, and some motor fibers and the olfactory fibers, the auditory fibers, I'm sorry, the most posterior fibers. Okay, and you can see here, this is the splenium of the corpus callosum and the forceps major here. Okay, now let's try to look for the tapetum, which is also a commisural fibers. You can see this is the lateral ventricle, and the septum pellucidum is just in the middle, septum pellucidum. Okay, and you can see this above the corpus callosum is the cingulate gyrus and the cingulate sulcus. Okay, so you see within here the fornix or the septum pellucidum and the fornix. Here we can see there are, we cannot see it, it's so too small, but there are some fibers that are related to the tapetum. Now the basal ganglia, we talked about it in many sessions before, and we explained it in abundance, but let's review them. It's a gray matter that is located deep within the brain at the subcortical level, and it includes the caudate nucleus, the lentiform nucleus, the amygdaloid body, and the calostrum. Okay, and the caudate nucleus is shaped, it's like C-shaped. Okay, it's C-shaped, and this will be the head of the caudate nucleus, and it is at the floor of the lateral ventricle, and it goes within the floor of the lateral ventricle into the temporal horn of the lateral ventricle. So this is all gray matter within the caudate nucleus, composed of the head that we saw in the previous images, and it goes along the body of the lateral ventricle. At the end of it, there is a rounded object that's called the amygdala or the amygdaloid body. Okay, and what is the function of the amygdala? Although it is so small, but it has a very, very important function. Does anyone knows what's the function of the amygdaloid? Memory. Well, memory has not been localized to any particular part of the brain. There is no specific site of the brain that is responsible for memory. Let's see. if anyone gets the answer. Emotions, okay, what else? Okay, cognitive. No, it is not responsible for any cognition. It has nothing to do with cognitive function. Emotions, some other people say emotions, what else? Okay, so it's a part of the limbic system, that's correct, but the scientific description of the function of the amygdala, it has it's related to what's called fight or flight. Okay, the amygdala is responsible for the how can I say it? It's sexual, fight or flight, exactly. So it's either it's important for the preservation of the being, the human being, or any other living animal. It's either when the person is faced with danger, he has one of two responses: either fight or run away. So in order to either face the fear or attack it or run away from it, who decides that? The amygdala. Okay, it is responsible for that. So both conditions are related to preservation of life. So now let's talk a little bit about the caudate nucleus. It has a head, body, and tail, as we saw previously. Its thin tail ends at the amygdaloid body, and it's lies within the concavity of the lateral ventricle, as we saw. Head in the floor of the anterior horn, while the body along the body of the lateral ventricle, while the tail it's in the roof of the inferior horn. So we can see these parts more obviously in a coronal image. You can see here anteriorly, you can see the head of the caudate nucleus within the floor of the lateral ventricle, and as you go posteriorly, you can see the body, and you can see the end of it within the roof of the temporal horn of the lateral ventricle, and at the end of it is the amygdala. Okay, let's see what else can we see here. First, we have here the falx cerebri, and at the base of it is the superior sagittal sinus, and of course here will be the corpus callosum. Just superior to it is the anterior cerebral artery, and then the cingulate gyrus on both sides, and the cingulate sulcus here and here. And what else? The fibers here are called the corona radiata. Okay, that is fanning from the corpus callosum into the cerebral cortex. And what else? Let's see. We have here the optic nerve and the olfactory sulcus. This is the sylvian fissure, of course, and here we can very easily see the insula covered by the overlying cortex, the temporal operculum and the frontoparietal operculum. Okay, now the lentiform nucleus is located between the two limbs of the internal capsule, the anterior limb and the posterior limb, and you can see this is the lentiform nucleus that is composed of two parts. The medial part is the globus pallidus, and the lateral part is the putamen, and it's connected to the caudate nucleus by thin striations forming what's called the corpus striatum, and posterior to it located the thalamus, and in between the two thalami we have this slit-like space which is the the third ventricle, and here you have the splenium of the corpus callosum with the forceps major seen here. Okay, and of course this is the forceps minor. The colostrum is a gray matter in form of a thin sheath, thin layer of gray matter. It's located between the lateral aspect of the putamen and the insula, in between them, limited internally by the external capsule, while externally by the extreme capsule. So it is sandwiched between the external capsule and the extreme capsule. Between them is what we call the colostrum. Okay, so let's have a look at this magnified view. You can see here is the amygdala at the tail of the caudate nucleus, as we said before, and you can see here this is the lentiform nucleus, and here is the internal capsule, and then the external capsule. Then there is a very thin layer of a gray matter called the colostrum, and lateral to it is the extreme capsule. So you have the extreme capsule, the colostrum, the external capsule, and here we have the insula covered by the auricula, forming the this is the sylvian fissure, and you can see easily here the internal cerebral artery here and here, bifurcating into anterior cerebral artery and middle cerebral artery. You can see it's bifurcating into anterior and middle cerebral artery. Also the optic chiasm is very obvious here. Now I think we should stop here possibly and maybe continue later, because I don't want it to be too much. Thank you for your attendance. We will continue after 2 days as usual. Thank you very much.